Myanmar is the country in Southeast Asia with by far the most malaria, and it's also a country with a lot of challenges. We've been working in Myanmar since 2009, so about 3 years before they went through a transition, not to democracy necessarily, but toward democracy. And they just signed a kind of a pre-agreement to a peace accord between the government and I think about 16 of the many armed ethnic groups that ring the borders of the country. Now, the same borders of the country that are, where there's a lot of civil strife and conflict are the areas where there's the most malaria. And we have the vulnerable populations, mobile workers, migrant workers, plantation workers, soldiers, gem miners, and so forth. That's who gets malaria. So it's a challenging place to control and eliminate malaria, but we think there's actually a real opportunity to work with all the different partners in Myanmar to get people to come together around a national campaign to eliminate malaria, much the same way warring parties would call a ceasefire in order to come in and immunize people against smallpox when we had a smallpox eradication campaign.